Yep, I'm graduating in the program in public health in the College of Human Medicine, and I have a couple things to finish up over the summer, but I'm graduating right now in the spring, walking in the graduation ceremony. I'm going on a trip to Ghana in a couple of weeks for a month, and when I come back I just have a paper to finish up, and then I'll be applying for jobs. There's 4 different focus areas: maternal health, nutrition, child health, and water and sanitation. So I'm in the water and sanitation group. So it's an old program, but they've kind of revamped it this time, so we're kind of the guinea pigs. So I'm really excited. I'm not exactly sure what to expect, but we will be researching water and sanitation and see how it is over there, and see how their traditional methods for health relate to Western medicine like we have here. So I'm excited. For about 8 months, so I just went by myself. It wasn't through MSU. I did get credits for it, but yeah, I was there, so that was fun. I'm a little bit nervous just because I'm not sure what to expect. When I went to Brazil, I had visited before, so I'm not really sure what to expect, so I'm a little bit nervous, but I'm super excited. I met the girls that I'm going with, so they all seem like a really nice bunch of girls. So well, it's all online. I started the semester right after I graduated from my undergrad, which I also got here at MSU. And my undergrad was in global and area studies, and so I had one course in my undergrad that the professor, she was a public health professional. She had gotten her MPH, and she kind of talked about that in our class, and so I was like, wow, that might be something I'm interested in. So I applied and I got in. I'm also a research assistant on campus, so I just started doing that. I really like the online format, that I'm kind of free to do my job, you know, whenever my boss needs me, and do my courses at the same time. I don't think so. I always worked through my undergrad, and so in the summer I always worked 40 hours a week, so I took a lot of online classes during the summer because, you know, when you work 40 hours a week, you can't really fit another course in there. So I always had taken online classes just in the summers for my undergrad, and I like the online format. I think the program in public health does a good job of structuring them. Like, all the classes are very similar in the structure, and using the Angel program it's easy, I think, you know, after you get the hang of it. So I like it. Well, we had less interaction, but I mean, we did less face-to-face interaction, I would say, because we did have discussion boards where we would have, you know, rolling discussions, and I had one class where we had group projects, so we would constantly email back and forth, and, you know, we were putting together a paper all together. So I definitely, today I'm meeting a lot of people. I recognize their names, but I did not know what they looked like. Going to Ghana, doing a study abroad program does help you to meet some people in your program though, so I have met some people. Unfortunately, it's at the end of the program, but I did discuss with one professor about maybe having like webinars or something, having people that live close meet together and letting other people like have a conference call in or something like that, so we can have some more interaction. But I mean, it was okay. I think it could be improved though. I think probably yes, I think I could have if it weren't, but I'm not exactly sure. Just, I don't have anything to compare it to actually, so, you know, I'm not exactly sure. I think it would have been more difficult to work at the same time. You know, for some students that's okay. I do have to work, you know, so I think that makes it easier.
Sure.
Well, I already have some people. I interned last semester at the Michigan Department of Community Health, and doing my practicum and everything, that's giving me a lot of really practical experience. So I have high hopes for my job and everything in the future. So I think it's really going to help me. I mean, public health is a growing field, so I definitely think this program has helped me to find a job, because when I first graduated with my undergrad, I mean, the economy was, there was no chance of me finding a job really, so I think this has helped a lot. In global and area studies, and I focused on international development through there. I'm looking at a lot of different things. I didn't really focus, I mean, I could have focused my elective courses through this program on something specific if I wanted to, but I kind of took a wide array of classes, and I'm really interested in nutrition, but I really like international public health and global public health, so we'll see. I'm not sure, you know. I'll just go wherever. Yeah. I didn't want to focus anything too specific because I didn't want to limit my job options, you know.
Yeah.
So I think it's a great program. I mean, I think it's a good program for people wanting to go to med school. I know a lot of people who wanted to go on to med school. You know, I think it's good for everybody. Honestly, I learned so much, and I enjoyed it a lot, so immensely. And I think it's a growing field, and there's going to be a demand for people in public health. So I think it's great. I would recommend it to anybody. The most interesting thing, you know, I took one course called Intro to Counterfeit Pharmaceuticals, and we learned about all the counterfeit pharmaceuticals that are out there, and I thought that was very interesting because I guess I was naive and oblivious to the whole thing. I mean, I thought that only happened in other countries, and you know, I didn't really think we had that issue here, but we read a whole book about a huge thing going on here with counterfeit pharmaceuticals. So that was shocking. I was very intrigued by that. So that's the most interesting thing, I would say.